Welcome everybody to the presentation regarding Beyond Memorization, Leading with the Why to Improve Clinical Reasoning. My name is Jensen Lewis. I'm an assistant professor and the director of didactic curriculum at the PA program at Case Western Reserve University, and I'm joined by Dr. Leah Sheridan. Leah.
Hi, everyone. I'm Leah Sheridan. I'm a professor of physiology at the Ohio University Heritage College of Osteopathic Medicine, and I am also a science lead on the Aquifer Sciences course board.
Thank you all so much for joining us. This session is sponsored by Aquifer, a nonprofit organization, and Dr. Sheridan receives an honorarium for her role on the Aquifer Sciences course board. So the agenda for today, so we're going to talk about the why and why it matters. Then we'll talk about how integrated illness scripts are going to help, what we do here at Case Western Reserve University when we use illness scripts, and then we'll have some time for a Q&A. So the why. So as a PA educator, I am constantly looking for ways to have our students get away from strict memorization. And I have found that using and forcing our students to understand the why behind clinical medicine presentations has really helped improve critical thinking and clinical decision making. I make it a point for our students to not just memorize symptoms and signs and treatment for various disease processes, but actually tell me why a patient will present like they do. And so here at Case Western Reserve University, we have really started using integrated illness scripts throughout our entire curriculum from didactic to clinical year, which we'll talk about here in a little bit. And again, just teaching clinical decision making. This photo here is an example I like to use with my students as they're listening and auscultating lungs or hearts. Why are they going to hear the various lung sounds that they do? Why are they going to hear the different percussion tones that they have when they're percussing the lung fields? And it's gone a really long way into deepening students' understandings of disease process, and I really love integrated illness scripts in that regard. Our goal is to educate students to make better, safer clinical decisions supported by sound biomedical reasoning. As we all know, students always struggle to understand the importance of the basic sciences. And so I've made it a point to really integrate our anatomy and our physiology with our clinical medicine to help students make these safer, better clinical decisions. So what is cognitive integration? Cognitive integration is a process that occurs in the minds of learners and experts as they interweave relevant basic science and clinical knowledge using conceptual connections when reasoning through a patient problem. And the thing that I always tell my students, if you understand the why, you're then going to know many more things down the line without even ever having to have encountered them before. And again, I'll give you some examples here in a little bit. And why does it matter? Research shows that effective cognitive integration improves diagnostic accuracy, particularly in novice clinicians. We all know that PA education is rapidly paced, very, very fast, 2 to 3 years at a max, and then at the bedside. And so I've really made it a point to get our students ready to go day one as they become a practicing PA. And now I'm going to throw it to Leah, and she's going to talk about how integrated illness scripts help.
Great, thanks, Jensen. So integrated illness scripts are a new learning tool developed as part of the Aquifer Sciences initiative, which is dedicated to the integration of basic science and clinical learning. Scripts are an evidence-based tool. They're developed by experts specifically designed to promote cognitive integration in the minds of our learners. Our scripts are a framework, or you can consider them a new mental model that links the basic science and the clinical knowledge by interweaving the causal mechanisms of a disease and the clinical features for the conditions, providing a deeper understanding of why each condition occurs. Integrated illness scripts are a learning tool available from Aquifer, but more than that, they are a pedagogical approach to learning that can be applied in any program or learning environment. Integrated illness scripts are actually a modified version of the traditional illness script. Let's take a moment to look back at a traditional illness script to understand the differences. An illness script is the term for the mental model by which a clinician stores relevant biomedical concepts and their relationships to clinical conditions. Expert clinicians draw from a repertoire of scripts developed through experiences to drive clinical decision-making. Novice clinicians naturally begin the process of illness script development the moment they begin learning about diseases and conditions. In the traditional model of an illness script, knowledge is organized into three main components, which you see here: the enabling conditions, the pathophysiological fault, and the clinical consequences. As an example, this is an illness script for asthma that is organized in the traditional format. So on the surface, this appears both succinct and nicely integrated, providing novice learners the relevant basic science details on asthma on the right, and then adding the more clinically relevant information on the left. However, separating the basic science and clinical concepts is still missing the mark here. Leaving this information separate doesn't truly integrate the information or lessons learned from research about how learners recall and transfer knowledge most efficiently. So to achieve the fully integrated structure for integrated illness scripts, we applied the lessons learned from research to write truly comprehensive descriptions of clinical features, pulling in each core concept that underpins the causal mechanisms. It's at this level of integrated holistic understanding where effective lifelong learning and problem-solving abilities truly begin. This is how information should be packed and encapsulated in the minds of a clinician starting on day one of their education. And this is what you'll see in each clinical feature in each integrated illness script. So now let's take a look at the full structure of what is included in an illness script. Each script contains an overview, an epidemiology, and up to 6 key clinical features of a particular condition. Additionally, each script offers space for learners to capture implications for further workup and management, as well as references for deeper dives. A corresponding mechanism of disease map offers a visual representation of the causal mechanisms of disease presentation. An overview of the condition includes the underlying pathophysiologic insult, or you can think of it as the answer to the question, everything was going fine in this body until this happened. The epidemiology section provides the public health context of the condition, covering gender, peak incidence, risk factors, and predisposing conditions related to this diagnosis. Then each clinical feature includes the underlying basic science causal mechanisms that explain why a patient with that diagnosis displays that clinical finding and connects that back to the core science concepts. This is where you'll see the fully integrated text with basic science and clinical content interwoven. And finally, there are 2 sections where our student learners can add notes for themselves, and that includes the implications for further workup and for management. The mechanism of disease map corresponds to exactly what was written in the integrated illness script, but shows a visual representation of the causal mechanisms that start with the underlying pathophysiological insult and then lead out to the clinical features or the clinical presentation of that condition. So now I'd like to talk about how integrated illness scripts can help you at your institution. So what we found is that integrated illness scripts are a wonderful framework for learning that helps students make connections between the clinical context with the underlying mechanisms, the basic science mechanisms of why these clinical findings are occurring in a particular disease state. So one example that I'd like to share with you that I have actually used to apply the integrated illness script tool at my home institution of Ohio University at in the College of Osteopathic Medicine actually was born from a request from our osteopathic medical students. They came to me and asked as a physiologist, if I could help them understand the physiology underpinning the osteopathic manipulative techniques that they were learning from their osteopathic physician faculty. So at the time, I was working with Aquifer to help start developing these integrated illness scripts, and it presented a truly great tool for me to approach this problem that the students have requested. So I use the integrated illness scripts in the first year of osteopathic medical education to walk students through the physiology underpinning a particular clinical feature that would indicate an OMM treatment is necessary. For instance, if there is a patient that is presenting with a tender point, the OMM or the osteopathic manipulative technique that's indicated for a tender point would be counterstrain. So I use the integrated illness scripts to both describe the physiology of it or the pathophysiology of a tender point presentation in a patient. And that is the clinical feature with the integrated science mechanism beneath or truly integrated. And then I also integrate the science underlying the manipulative treatment of counterstrain, so students can understand the mechanisms that support the use of counterstrain to teach the tender point. And this has been really well received by students, for they see the science right in the clinical context that they're learning from their osteopathic faculty. And I roll these out in a stepwise fashion with our students. I give them small aspects of the integrated illness scripts to work through on their own before we start building onto them. So I may ask them to translate the integrated aspect of a clinical feature with their physiology mechanism into the mechanism of disease map. So they would convert that prose into a visual picture of the mechanisms leading to a tender point presentation. And then I will have them build in more and more pieces of the illness script so that they can appreciate the true integration of the script and its value to their clinical learning of osteopathic manipulative medicine. So with that, I'll turn it over to Jensen to talk about what his experiences are at Case with integrated illness scripts.
Absolutely. So here at Case Western Reserve University, our goal is to teach students to avoid strict memorization. Far too often we find that with the rapid pace and rapid nature of PA school, the students really want to learn the buzzwords, the hallmarks, etc. But what I want is our students to be ready to go day one as a clinical year student or as a practicing clinician. And so I really make it a point to help our students understand the why. And so the example I always give to them is I can tell anyone that a patient with otitis media is going to present with ear pain. But what I want is my students to be able to give me the underlying reason that person will have ear pain. That takes this from strict memorization, which anyone in any part of the world can do, to a practicing clinician who's going to make better, safer decisions. What that also does is it helps us understand why a patient's going to present like they will. And then the most interesting thing about this approach is if you know anything about pharmacology, you can then think through why we're going to treat a patient like this. It's incredible to see the integration, because what I tell my students is the mechanism of action of drugs is going to fight the underlying pathophysiology. So if we know the why of a patient presenting as though they are, then we can reasonably get to a treatment without ever having been explicitly taught that exact treatment, which is really powerful. So how do we use integrated illness scripts at Case Western Reserve University? Like I said earlier, we use illness scripts throughout our didactic curriculum as well as our clinical year curriculum. So I'll give you a few examples. So in our pediatrics course, for instance, I've divided our pediatrics course into basically three teaching styles. We do have our traditional lectures. We have lectures where we'll do small case studies, and that is where we actually use integrated illness scripts. And so in class, at the very beginning of the class session, myself or whoever's teaching the session for the day will present a case study. So for instance, in pediatrics, we will do sore throat. Patient presents with sore throat, and that's all the students get, sore throat. And then we develop a very large differential diagnosis list, and pre-session I have chosen the 5 entities that we will create integrated illness scripts on in class for that day. So we'll develop a very large differential diagnosis as a group, as an entire class, and then students will split off into groups of 3 to 5 where they will complete and create their own integrated illness script regarding one of the 5 entities I had pre-selected. So for instance, maybe one group will do an integrated illness script on epiglottitis. Maybe one group will do it on peritonsillar abscess. Maybe one group will do one on strep throat, whatever it may be. And then, so we'll leave time in class for the students to complete create their integrated illness scripts. And then we'll come back together as a large group, and each small group will present the integrated illness script that they have created for epiglottitis or peritonsillar abscess. And so what happens is now we're going through the integrated illness scripts as a class, excuse me, as a large group in the classroom. And so students may work on one, but by the end of the session, now they've gotten essentially 5 completed in a sort of flipped classroom type way. We use them throughout other courses as well. We use them heavily in our physiology course, which happens in the semester we kick off our clinical medicine series. And so that is just one example how you can sort of pick up and use illness scripts right away. It does take a little bit of learning for the students to understand the depth at which they need to provide, but feedback from students has been unbelievably positive. It's also a great remediation tool for students who are struggling, specifically in the clinical year on their end of rotation exams, maybe in the basic sciences. We'll pull the content from their report, and maybe it was basic science of diabetes or whatever that may be. We'll have students complete integrated illness scripts on the topics in which they were struggling, especially in the basic sciences. And it's a valuable remediation tool. The nice thing about it is it takes a little bit of effort on students' behalf in order to really learn the material, to complete an illness script that is of use to them. So it's really worked to be a great remediation tool throughout all of our curriculum, didactic or clinical year. So takeaways. The things about integrated illness scripts is, as I've used them for the past several years, as we've tried to make clear, it's an unbelievable tool to help understand the why behind really anything. One thing that I've done as we continue to work with illness scripts is feedback I'd received from students prior to them putting together an illness script, especially if they're doing it on their own and not using the Aquifer platform. I would provide the students with the clinical features that I wanted them to focus on. Heart failure can present with a number of different clinical features, but I provide the students with the clinical features to have them focus on. Again, they're an amazing, great tool for remediation. And really, these are an amazing tool to help bridge basic science courses to clinical medicine courses. Our anatomy occurs in our first semester. Our clinical medicine doesn't start till the second semester, but I still use illness scripts in that regard. It reviews the anatomy and they're learning physiology in the second semester, and students see a great integration in that regard, and it has been wildly successful. So it is an amazing tool.